A very good evening to our viewers. I hope we are all keeping safe during this pandemic, and I welcome a very good evening to SPYL's public engagement. I hope we are all keeping safe matters during this pandemic, and I welcome a very good evening to SPYL's. I'll be the moderator for this session. During this pandemic, I'm joined by Dr. Makemba. I'll be the moderator in the middle of this session. And on my far right, I'm joined by joining us all the way from the moderator in the middle of this session. And on my far right, I'm joined by SPYL Secretary for Health and Population. So this evening, theme is vaccine immunity, population, COVID-19. So, Virology theme is our theme for this evening is vaccine immunity. So, and COVID-19 theme is virology. Our theme for this evening. So, after having introduced the theme, I now hand over to the theme is virology. Julius, so after having introduced the theme, I now hand over the theme is virology. Julius, so after having introduced the theme, I now hand over the theme is virology. Can you hear me? So after having introduced the theme, I now hand over the theme is virology. Can you hear me? So after having
unmute his mic.
Comrade Julius, can you unmute your mic?
Yeah, it's unmuted. Thank you very much, comrade moderator. Comrade Matengu would like to
unmute your mic.
Yeah, it's unmuted. Thank you very much, comrade moderator. I would like to
unmute your mic.
Dr. Makemba and Dr. Kanyemba. I would like to
unmute
Dr. Makemba and Dr. Kanyemba. First and to the SWAPO Public would like to register it and Dr. Kanyemba to the nation. His Excellency the President and the Minister to register it. The cabinet ministers, internal and the nation partners of the government, the President and the Minister to register it. To cabinet ministers, internal and the nation partners, indeed the government, the President, who are our frontline health workers. Cabinet ministers, internal and the nation partners, indeed the government, the President, who are our frontline health workers. They are internal and the nation in combating the aim of this intervention of this program is to create an enabling environment and a conducive environment for the young compatriots of this country to engage on issues pertaining to our public health care or system. And at the same time, the SWAPO Party Youth League Central Committee believes in collective intelligence and collective decision-making. That's why we have deliberately initiated this platform so that we can rope in experts in the health fraternity to deliberate on issues pertaining to our health care. And also, basically, the aim is to look on ways how we can reform and revamp our public health care so that we have a very strong, healthy Namibian nation. The purpose of today's episode is basically to focus on COVID-19, the novel coronavirus, which became a serious threat to each and every one of us. But these episodes will continue. It will be an ongoing exercise, either on a weekly basis or at least every second week, so that we can come together as young compatriots of this country and deliberate on how we can reform the public healthcare sector. For those colleagues who are watching us, who have interest, who would like to make some meaningful contributions, as I've alluded before that we believe in collective intelligence, can always reach the party, can always reach us at the following number, 081-3597-384. So, comrade moderator, in view of what I have emphasized, I'm giving you back now the platform so that we can continue with the deliberations.
Thank you very much for this. I think at this juncture now, to me like this honor and privilege to hand over to our health experts so that they can explain to us what is this coronavirus or the COVID-19? What are its origins and what is known about it? So what do you, Dr. Kanyemba? So just explain what is COVID-19 and its origins, just for starters.
Thank you very much, moderator. Thank you, Comrade Julius, for introducing the topic. I think, as you said, the idea really is just to have a discussion on current health matters. The current health matter at hand is the novel coronavirus. Since March 2019, coronavirus was globally diagnosed as a pandemic and a global health challenge. Now, initially, the world was unprepared for the novel coronavirus, but as time went on, public health measures were put in to sort of buy time so that the world can get to grips with this virus. Basically, today with Dr. Makemba, we will discuss this virus, what the condition is that this virus causes, and how it affects the health of our society. So basically aim for today, just to introduce coronavirus, we want to keep it as informative as possible without needing to discuss big details, to show that this is just a disease, and as diseases go, it can be controlled, and we are able to manage the disease. So Dr. Makemba can come in.
Yes, very good evening to comrades and everybody that is joining us on this platform. And it's a great honor to be invited and to be part of this discussion tonight. As it has been said earlier, my name is Dr. Makemba. Basically, coming back to just what Dr. Kanyemba had said, of course, COVID-19, as it says, the word 19, of course, it's a fact that it started, showing up in the year 2019. That's where the name comes from. It had appeared to be that the sender or the epicenter where it emanated from that time is Wuhan, in Wuhan province in China. And of course, we know that it's a viral infection. It's a respiratory infection, meaning that it affects our respiratory system. And of course, it has had its waves that we have been seeing going across the globe as up to now. And currently, of course, with us in our country, we are in what now we are seeing as a third wave. And it's quite a little bit devastating. The way the nature in which the disease is behaving right now is probably, what then we are looking at as a Delta, variant that has been, spoken about, primarily based on the disease behavior. And of course, this variant comes about, as the disease progresses over time, the virus then tries to readjust also to an environment where it finds itself as we are fighting it. So it tends to mutate. The mutation is what now has brought about, the so-called Delta variant. And of course, it's seemingly the Delta variant is spreading it is easily transmittable from person to person. And of course, the outcome of one having picked up a Delta variant compared to what we have seen earlier when the pandemic was declared, it's more devastating than anything else. That's why we are probably experiencing more loss of lives now with this Delta variant.
For that insightful introduction about COVID-19 is all about. Maybe just for the sake of our audience out there, what can be some of the possible symptoms that are related to this COVID-19 virus?
Right, let's start off like this. Oftentimes, of course, it's a respiratory illness, like we have said, affecting your lungs cavity. So what it does oftentimes in the initial presentation is really simple. It's more flu-like presentation. Maybe a stuffy nose with loss of sense of smell and taste, headaches, generalized body pain, joint pains, and fever. That has been the initial presentation when the pandemic was declared. But of course, as time has progressed, it looks like the presentation of the nature of the disease has also changed to an extent. Sometimes now you find a client might present simply with just vomiting and diarrhea and fever, and maybe there's not even coughing. So the presentation is changing over time. And of course, like we're saying now, we're in a pandemic. And we are studying the behavior of the disease as time goes. Yeah, so these are basically some of the clinical presentation. And of course, oftentimes these are then individuals that will then present with a history of either having had a contact with somebody that has presented that has tested positive, or maybe having traveled to an area that is, deemed as an epicenter where there are more cases. Normally, those are the kind of history that you get, with this kind of presentation.
Just to come in to support what Dr. Makemba has said, when we look at the human body, it's important to know that just for understanding and also function, the human body is divided into different systems. For example, you have the respiratory tract. Now, the respiratory tract is from the nose all the way to the back of the mouth, the pipes that bring the air into the lungs, and the lungs themselves. Now, initially, the family of coronaviruses, they were already known, and they were flagged a few years ago as viruses of the upper respiratory tract. Now, that's a very big family, and includes flu viruses. The word corona basically just describes the entire family on the way it looks. Now, the world knew that the next pandemic that would probably come up was going to be a respiratory pandemic. But we were not sure which type of respiratory pandemic it would be. But if you were listening to history and if you followed the news, we heard of SARS and MERS, Mediterranean respiratory syndrome, and systemic adult respiratory syndrome. Those were sort of like the predecessors of what we're seeing now. So the full name of COVID-19 is actually SARS-CoV-19. And the first outbreak, like Dr. Makemba said, was in Wuhan. The reason for the outbreak being in Wuhan should not be used as, because some of the notions out there in the public is that we're trying to blame China. It might as well have been anyway. So what's being said is that there was some kind of a mutation that happened in the virus. Just like Dr. Makemba said, what happens to viruses, because we need to remember these are life, and life forms need to survive to maintain themselves. The problem with viruses is that if you look at let me not say human life, if you look at life itself, you have all the way from chemicals to complex systems like the human system. Now, the chemicals, in a way, viruses are somewhere between chemicals and living forms. What I want to say with that, because they're between chemicals and living forms, they do not have a full function to make more of themselves, to replicate. Now, if you look at life at its most basic form, life goes DNA, RNA, protein. That's how life makes more of itself. Just try and follow those concepts. Now, for you to make a protein is usually what life uses to express whatever function it needs to do. Viruses don't have that replicating mechanism. So they need a host to be able to do that. So that's the challenge with viruses. Now, if you need a host, you've got two choices. You can infect the host, and then that host helps you replicate, and then you move on. Or you can infect a host and become part of that host. Now, the reason COVID-19 is a problem is because it likes the cells of the lungs. Now, the cells of the lungs are two types. There is the whole cell, because basically if you look at the function of the lung is to take in oxygen from the air and to move it into the blood so it can be used in the rest of the body. Now, there's a lining there that allows gaseous exchange. Unfortunately for human beings, coronavirus likes those cells. And it likes the cell, what we call type 2 pneumocyte, a cell that makes a fluid called surfactant. Surfactant, okay, without going into details. So it likes those cells. Unfortunately, the virus comes in, it replicates, and for it to come out again, it destroys the cell. So that's the disease. Now we have realized now that initially that's the only thing it used to do. But now we are seeing that with the further mutation, it's going into the GIT system and it's going into other systems. And because of that, this is now how you get the expression of different symptoms that Dr. Makemba was referring to. So that's the background of what viruses are. Let me maybe stop there so that you can come in with more questions.
Doctor, by explaining that the coronavirus has been known for some time. If it has been known for some time now, why couldn't the scientific world then do more research and come up with better alternatives compared to what we are seeing right now? Because when you look globally and even here in Namibia, it looks like the virus is wreaking havoc. If it was known, why weren't there strategies in place, or at least research having been ongoing to say, no, let us try to mitigate the impact of this virus? Because when you look at how our lives have changed today, I mean, look, today we are sitting here, we are wearing masks. This is something we never knew all about. And then if it was known, why couldn't the scientific world out there, or medical doctors, why hadn't they done research and come up with ways to mitigate the impact? So is it safe for what to say we were caught off guard with what we are seeing now? Or?
Right. Let me explain it like this way. Let me just try and clarify. I think Dr. Kanyemba has made it clear. Remember, he's saying that there has been other coronaviruses. And the word corona basically is emanating from the structure of how the virus looks, its genetic makeup. Now, COVID-19 belong to the family of other coronaviruses. All the other coronaviruses that are known to human race has been contained, and there has been mechanism in containing them. Now, this specific one, COVID-19, it's also part of the family of coronavirus, but the specific one that we're talking about that was now discovered in 2019 and declared as a pandemic, it has come in with a different behavioral pattern in how it is attacking our body. Like Dr. Kanyemba was trying to explain, to say that it attacks that part of the lung. It's actually at the alveoli where the air exchange is taking place. And when those, pneumocytes, are destroyed, and the surfactant is not produced that is supposed to lubricate the alveoli where carbon dioxide comes out, oxygen get into your blood. This is where you find the problem with people struggling to breathe. And then the problem, then we say their oxygen concentration in the blood drops. You need to have at least a concentration between 90% and 100% to be able to ventilate your organ systems, which is your heart, lungs, kidneys, and brain, and everything else. Now, if the alveoli is destroyed, and the air exchange is not taking place as it ought to be, you could be sitting and breathing, but you're still feeling like you're suffocating, although nobody's holding your lung and nobody's holding your nose and your mouth. So the specific COVID-19 virus, although it is part of the family of the coronavirus, it's a different, variant that just came up. And of course, it's a pandemic now because it's wreaking havoc all over the world. And of course, in the medical fraternity throughout the world, we are hard at work, we are studying the disease behavior. We are trying to come up with mechanisms to contain it. It's not like it has been there, but we haven't, prepared for it. It's just part of the family of viruses that are deemed coronavirus. But this specific one, just came up recently.
And just to add to what Dr. Makemba has said, this is why we're excited that SPYL Youth League is taking up this topic. The word that you're looking for in your description is surveillance. Now, internationally, because of globalization, we have realized that the more we move, and that is what the public health measure of lockdown is all about, the more we move, We are carrying all the organisms that are around us. Now we have known and we know that there are organisms around us. And an organism in one area that causes a problem can easily get on a plane and go to the next destination. So what do? You start having surveillance mechanisms. One of the things that COVID-19 revealed is that as Africans, we don't pay attention to that part of things. We need to start taking part. We need to start getting into the bigger discussions to say, the people that are coming on our planes, what diseases are we detecting and surveilling? If we hear of Wuhan and there's corona outbreak there, Jose Kutako Airport, who is there? Is there Matengu? Is there Gwakoset? Is there Chirange there, sitting there, trained at our institution, detecting the diseases that are brought in and containing them? Imagine if this disease was, for example, because that's a bigger topic of surveillance. Imagine if this disease was a disease that affected cattle. Our agricultural sustenance would be wiped out. Unfortunately, now human lives are being wiped out because we do not have those mechanisms. So from these discussions, we should start building the appreciation of saying that this will continue happening. Like we said, Corona started now. There are other Coronas. We contain Corona, but we are already seeing that Corona is already changing because we are getting this, it's already changing. What is it that me and Matengu are doing to practice surveillance? Are we just going to wait for other people to tell us that no, there is SPYL in China or there is SPYL in Spain? Now, did you understand? So that's the topic of surveillance. And maybe perhaps in our future discussions, we can get to such topics to say, how do we protect ourselves in future from this happening?
Earlier on, I heard you mention about Delta wave.
Yeah.
And just maybe for the curiosity of the viewers out there, oh my God, wave called Delta. What is the Delta wave?
Yeah. You see, in science, of course, there's a language that we speak. You know, you see words as alpha, delta, gamma. Now, like we have said earlier, what happens is that virus by nature, on their own, they cannot survive, right? They need a host. In this case, coronavirus is using human as a host. So it gets into your body, it gets into your cells, it uses your cell to multiply itself. And then when it gets out of that cell, in the process, it destroys the cell. Now, what tends to happen, we have now the pandemic, it has been declared as a pandemic. And as human beings, we are trying to put measures in place to contain and fight the virus. So the virus now becomes clever and mutate. In other words, its genetic makeup transform itself to try and buffer off our fight against the virus. Now that mutation is where variants comes in. In other words, we are saying, initially when the coronavirus was now declared as a pandemic, we have been seeing this virus behaving this, but over the course of this few months that we have had this coronavirus around us, this virus is now also trying to become clever in challenging us as we are challenging it. So it's mutating itself, becoming stronger against the mechanisms that we are putting in place to fight it. This is where the Delta variant comes in, meaning that it's still the coronavirus, but it has become a little bit clever. It's now spreading faster. Its capacity to kill people has now increased. So now we have to find another mechanism again to try and address this thing aggressively. It's still the coronavirus, it's just that it has changed its structure. It's almost like, you have cars, If you compare cars that were produced in the 70s compared to the cars that are produced today, probably they are much better, with more safety features. So that's the kind of a nature of how the virus mutate. And then this is how we became, now we came to have the Delta variant.
Just to support what Dr. Makemba is saying, moderator, I spoke about life forms and different life forms. Viruses have the advantage that they are amongst the most basic life forms. What does life try to do? Life tries to survive and make more of itself. That is the function of procreation, is for us to pass on our DNA to the next generation. Our viruses also have the same challenge. I think we need to start looking at these things in the living forms that they are in and start understanding the challenges from those perspectives. Because as human beings, we tend to not appreciate that we are sharing life with so many other life forms. And the mission of those life forms is also to survive. Now, what do I do when I need to survive? If my enemy finds out that I have this tactic, like Dr. Makemba was saying, I change my tactic, right? Now, because you are a very simple life form, what is a virus? A virus is practically nuclear material with an envelope, finished. Nothing more, nothing less. Nuclear material with an envelope. In this case, the most basic form of nuclear material called RNA, ribonucleic acid. Now, that ribonucleic acid, that's the life secret of this virus to say, this is our ancestry. Our ancestry must go on. So on the envelope that covers it, that's how we know, okay, this life form looks like Makemba, that one looks like Matengu. Now, when I'm waiting for Matengu to come, Matengu wears Dr. Makemba's clothes. And that's really what Delta, let's not get confused by big words, because these big words are just basic survival tactics of living things. And you get that appreciation of living things. We need to start appreciating that, oh, when I wash my hands, I'm washing this thing off. When I protect the mask, this thing, I'm preventing it from getting in. So it's almost like biological warfare that we are fighting. I hope you follow.
Definitely. Considering that the virus has the possibility of mutating, is there any vaccine available to provide immunity, or what sort of help can one get once you are affected with this COVID-19?
All right. Now, as it is right now, we are in the middle of a pandemic, right? The idea is to, first and foremost, contain the spread. In other words, we're trying to come up with a mechanism in which we don't have so many people getting infected. This is where the concept of social distancing, washing your hands or using a 70% alcohol-based sanitizer and wearing a mask come from. Well, because we know that this thing is respiratory, right? It's airborne, right? Now, the concept of vaccine, by definition, a vaccine basically, it's an injection that exposes you to the very same organism you're trying to fight. But this organism is either attenuated, meaning that it's weakened. That if it's now you are inoculated or injected with a vaccine, your body then, picks up on that injection in producing antibodies. Antibodies are just, basically soldiers in your body that fights off infection. So when you get vaccinated, what we are doing is we are basically just trying to prime your body, to prepare it such that in case you now encounter the real organism, your body has now already built up memories against the virus that you're fighting, and it gives you a better fighting chance. In other words, you got antibodies already circulating in your system, such that if you now encounter this virus in real lifetime, your body has a platform where it can fight off the actual infection. That is the whole concept of vaccination, basically.
So to make things basic, moderator, remember I said this is biological warfare. Now, the human body also has to have ways to defend itself. Now, remember, before we are born, there's a process happening. Life only forms based on certain processes. Now, what happens is that you come from two different genetic people, your maternal, paternal, and they unite. So your initial survival is just about formation. After formation, yeah, you have to survive and also form other forms. So what happens to you? Initially, you are in the womb. In the womb, there are a few ways in which you protect yourself. You are already born with a skin. Yeah. So what is this? It's different mechanisms for defense against infections. Now, when you are born, unfortunately, even the human systems, there are what we call innate immunity, immunity that you are born with, and acquired immunity, two different types. Innate immunity, skin protection. This is, it's not for looking good, it's protection. You know, the hair on the skin is protection against temperature. It's protection. Form follows function, like they teach us in biology. Now, what is happening? Now I'm born on this earth. On this earth, there are different things, life forms that try to attack me. Now, when I'm very young, I don't know these things. So my cells in the body also needs to learn for me to survive. That's why, Molita Matengu, children are always sick. You have seen the child is always coughing, diarrhea. It's his way of learning about different diseases. Then next time he learns about this disease that caused diarrhea, he forms a memory. Those memories, they are stored. Next time when this diarrhea, same bacteria comes, it just activates. That is a difficult way of building up immunity. The clever people on this earth have decided, and it started 200 years ago with Edward Jenner in England, where he said, man, look, this thing that is happening. They had a problem with cowpox or smallpox, caused blindness, skin, and there was also death. So he decided, man, smallpox and cowpox are similar diseases. What if I take pus from that and put it in and make the body practice so that when they get the real infection, it already knows. And that's where vaccines started, so that our acquired immune system can have a practice, so that if deadly diseases come up, we don't go through that whole thing of getting sick, because the problem with getting sick first, it's part of your body's response, but the fact is you don't know if you'll survive. So it's unpredictable. So what is predictable? It's like when you are practicing for soccer and you are the national team. First, we give you Orlando Pirates here, Chief Santos to practice. Then we call Botswana to practice, even though they are shooting us at the border, but they are our family members. But we are actually preparing for a game against England. You understand? It's the same sort of principles with vaccinations. So this scare of vaccination, I don't know, Comrade Matengu, where it actually comes from. Because we have been doing this for the past 200 years. Just because you don't know about it doesn't mean it hasn't been happening. So let me just allow Dr. Makemba to come in.
It's like Dr. Kanyemba now was trying to explain to you. The history in which vaccines were introduced to the human race, as he had explained. We are now trying to take an organism, in this case, coronavirus that we are fighting. Now we weakened the organism in a manner that is not going to cause you harm. And now we introduce that weakened organism to your body through an injection. Now, what are we trying to do? We're trying to teach your body to recognize this organism should it come your way in real life. Now, when it's introduced in its weakened form, it doesn't cause diseases, but what it does, it is training your body to recognize the actual organism that will cause diseases. And now when your body is trained, your body then develops memory. We call this antibodies. Now, these antibodies will be circulating in your body. Now, just there waiting. Should now you enter and encounter this guy that is trying to fight you. Your body is now clever and your body is able to say, hey, hang on a little bit. I know you, I recognize you, and I have soldiers to fight you. And these are the antibodies that are produced by the vaccine. And these are the antibodies that will now help you fight off the real organism. Understand what we're trying to say? So the concept of vaccine is really to just basically, create that acquired immune system that Dr. Kanyemba is talking about, because then that is an immune system you acquire as you grow, as you get exposed to organisms. Now, this one, we are just introducing it to you in a controlled manner, in a manner that is safe, so that your body now has antibodies to fight off the actual organism. That's basically by nature and definition what a vaccine does.
Well, you're talking of vaccine. What does a health expert mean when they say, got vaccinated and you are immune?
Basically, immunity immunity and vaccination can be used interchangeably within depending on what you're talking about. But I'll go back to how I explained it. Remember, when you are born, your body doesn't know anything about the environment. We are learning, right? Immunity is a way for you to learn, simple, without complicating it. I don't like using big words. Sometimes as Africans, we think when we throw in big words, no, it's just practical things. Immunity is practice so that when the real match comes, you are prepared. I cannot, Comrade Matengus, pick you up, and my comradeness is showing. I cannot pick you up tomorrow for a match against England. You will be destroyed. It's the same concept, you understand? Just that this concept is now happening in the human body. The principles of life are uniform throughout systems. Life systems do not change now because it's a human system. It doesn't work like that. It's the same system. One of the things that when Dr. Makemba was talking, when I picked up about immunization and vaccines, one of the concepts that confuse people is, why was this one developed very fast, and why was this one not, and HIV is around, why don't we have anything for HIV? Sometimes those questions, we need to throw it into ourselves. Why is it that Kanyemba and Matengu do not have labs at home where they can develop these things? Now, the people who are developing these things, because we don't understand the concept, we are scared of them. But it's merely, moderator, it's merely showing that we are practicing. It is not a matter of saying that it's something completely strange and therefore we need to be scared about it. So I think that's what Dr. Makemba was talking about when of this whole antibodies being formed and things like that. And just like a soccer match, as you are training, you can train in different ways. So the vaccines that are developed, some people say, no, China is producing this one, America is producing this one, UK is producing. We don't trust the UK, we don't trust. It's not about that. It's about having a soccer match. Obviously, different coaches will have different tactics. It doesn't mean that one coach is superior to another coach. It's about a soccer match. And I think let's keep concepts for what they are so that we can avoid confusion.
And I think just to add on that, it's just like, for instance, you and I and Dr. Kanyemba, we all dressed up, right? What do we call these clothes? But the name of my clothes might not necessarily be the brand of your clothes, but we are all dressed up in clothes. So if, for instance, there's a vaccine produced in the United States, one in the United Kingdom, and one in China, it shouldn't confuse people to say, but why so many? It's like saying, why is the Adidas, Nike, and the Reebok? It's the same thing. These are all brands, right? But they are all producing, clothes. Just that individual will then brand their product because this is me, I produce this and I branded it as this. But, the whole purpose of, the product is to achieve, the same end goal. You understand what I'm trying to say? So basically, this is where now you have, different countries that has the capacity and the ability to produce the vaccines, producing the vaccines, of course, branding it, to distinguish it, to say that this is the one that we as a country or as an institution has produced. But the end goal is basically, like Dr. Kanyemba have said, to prepare your body such that when you encounter the real organism, your body is now able to fight it off.
And importantly, the fight now is that it's between dying and being defeated. It's better to be defeated than to be killed. You understand? Now people ask you, no, this vaccine is not helping. Why must? Do you want to die or do you just want to be beaten? That's the choice we are making. I will take being beaten up so that maybe tomorrow I'll come back to fight you again.
Okay. Can also just ask Comrade Julius. So Comrade Julius, what interventions have the SWAPO Party Youth League done in combating COVID-19 in terms of communicating to the public and the Ministry of Health? Maybe you can just inform our viewers out there to say.
Thank you. Thank you, Comrade Moderator. We have really, since it was declared by WHO early 2020 as a public, as a pandemic or epidemic, we have communicated to the Minister of Health on various issues pertaining to COVID-19, because it's equally a grave concern to the SWAPO Party Youth League, as I've alluded before. We believe in a healthy nation, because the healthier the nation is, the more productive it is, it will achieve its economic goals. We communicated earlier the previous month of June, also another communique to the minister, where we have provided practical solutions to help combat this deadly virus. And most of our communications or most of our assertions were considered, and it formed part of the new protocols that His Excellency have just communicated to the entire nation two days ago. So SWAPO Party Youth League is also equally in the process to produce, more posters, and also to have more outreach programs such as this one that we have started with today. As the Chinese are saying that a journey of 1,000,000 miles starts with a single step. And we are very proud of this engagement. I personally also tapped a lot of information from our two doctors, and I'm very proud that we have youthful doctors for this episode so that we can convey the much needed information. Our next will be also to engage through radios, interviews, and we are equally in support of what the doctors have just alluded to currently, that we need to fast track the vaccination. And we also equally have communicated to the minister that we should solicit or we should acquire other vaccines so that we can, accelerate the entire process. And the minister have confirmed that more vaccines are coming earlier this month of July, and Johnson & Johnson is coming in August. But we would also like to ask, we have also communicated to the minister to consider Abdallah vaccine that was recently produced by Cuba, so that we can have variety of vaccine. But we support vaccination, and we would like to urge fellow young compatriots to sanitize, to social distance, and wash their hands under running taps, as well as physical distancing also. That's what we need to discuss about. Physical distancing is of paramount importance. As much as we apply social distancing, what are we doing also physically? That's also one thing. And we need to also be ambassadors. SWAPO Party Youth League believes that this fight of COVID-19 is collective, as I've said, that we believe in collective efforts. All of us should be ambassadors. We should educate our friends, families, fellow countrymen and women in the fight against this deadly virus. But we are on board, and we are also soliciting more resources so that we can take these outreach programs to all the 14 political regions through our regional secretaries and the districts, as well as the branches, so that we can accelerate the fight against COVID-19.
Comrade Julius, so there is a lot of conspiracy theories going on amongst our young people about the vaccine, and there's a lot of myth going on. How do you demystify the vaccine? How will you ensure that you restore the confidence in young people to say, look, the vaccine is the right solution to this problem that we have? If we want to go back to our normal lives, the only way out of it is for us to get vaccinated. But there is a lot of conspiracy theories, especially on social media. People have been discouraged. If you take the vaccine, it's this and that. There's a lot of conspiracy theories and a lot of myth out there. So how do you demystify the entire conspiracy theory going on around the vaccines there?
Thank you, Comrade Moderator Matengu. It's a very valid question. I don't buy in with conspiracy theorists. We are in the fourth industrial revolution, and if you look at the level of advancement in technology, we cannot compare it 50 years ago. As our doctors have alluded before, there has been serious progress in terms of technology, and we cannot compare vaccines that were developed 20 years ago. Yes, the speed has been approximately 1 year. It was produced over a period of year, but those are just conspiracies. They are naturally people who have been against vaccines. But I would like to allude during these deliberations that all of us, as we are here, we were vaccinated. From being an infant in our early childhood, we were vaccinated. And every Namibian should have confidence and trust in the government. It's the same government that is still vaccinating the infants as we are speaking. As a parent, I took my kids several times for vaccination. So these fabrications and propaganda should be controlled, because our people are dying and these are valuable citizens of our land. And moving forward, we have proposed a SWAPO Party Youth League to the Minister of Health and Social Services during our communique and a research report on the public health sector. We have also said, basically, it's time that we need to look at pharmaceutical plants across the country and also support scientific research. It's high time that more resources are availed, that we have our own scientists, so that these type of developments can also be locally produced and procured, so that we can save money. As much as we spend also money now on the vaccine, we are exporting our capital. So the right thing to do now is also to encourage, as His Excellency, the founding president, El Comandante President Sam Nujoma has encouraged us. Let's venture into science. Let's have more debates, but let's also not undermine scientific research. These are scientists. These doctors we have today during our deliberations, they have spent not less than 8 years during their studies. So let's have trust and confidence, and let's get vaccinated, and let's contain the virus. As we speak, Euro 2021 is prevailing in Europe. We have witnessed people are at big stadiums. You have watched the match between Germany and England at Wembley. It was very full. Nobody had a mask. But today, in our small population with approximately 2.5 million people, we cannot even take a chance to walk without a mask. So those theories should become repentant, and they should agree that science has advanced. We are in the fourth industrial revolution. The scientific research methods have changed. It has been done, and it has been verified thoroughly. Other vaccines were also verified by WHO, and these vaccines were approved by WHO, because they are also scientists and experts who are part and parcel of these vaccines.
Thank you very much, Comrade Julius. So back to the doctors here. So doctors, if I understood you correctly, you said the vaccine is to teach the body about COVID-19. So a young person out there might have COVID sometime, and then the body defeated COVID on its own. And they will be there wondering, but if I had COVID and the body managed to recover without the vaccine. What is there really a need for me to go and vaccinated, or how? Because I had the virus before. My body managed to defeat COVID-19 without any vaccine. Why would I then now be told to say go and get the vaccine when I had fully recovered without the vaccine itself?
All right, let me answer you by starting off by saying this. All right, let's say, for instance, an individual was now infected with COVID-19, all right, and they've made their full recovery. Of course, there's an element of immunity having been built up in that space that they were exposed to the virus. But now, if you look at how this vaccine is designed, you basically are getting 2 injections, all right? Now, the reason why you're getting 2 injections is because, normally with the first injections, you might just build up immunity to a certain degree that can last for a certain period. And therefore, you need to get what we call a booster injection. That's where the concept of a second injection comes in. And now remember, this is not only peculiar to COVID-19. It's even used in things like hepatitis B infection, which, for instance, us in the medical profession, as early back as when we were medical students, we were vaccinated against hepatitis B. Why? Because we are working with blood product. And then you get your, booster shot. And most of us now, we do get at least 1 shot of hepatitis B on a yearly basis. Just in case, if I'm trying maybe to operate and I end up cutting myself and my blood and the patient's blood mix and the patient has hepatitis, I'm protected. So the whole concept of getting vaccinated, even if you have had the actual infection, it's to boost up the immune system so that then the immunity or the memory you're building up is long lasting. It will carry you for a longer period of time. This is the whole concept of vaccines. And of course, like we are discussing also, there is a possibility that, of course, this COVID vaccine can actually, be even made a yearly thing, Of course, going forward, depending on the research and what, the outcome of the research is, it might even come to a point where it would be recommended that one might actually need to take, the shot on a yearly basis. So this is the whole concept of how vaccines work, just like a normal flu vaccine. For instance, we do give flu vaccine almost at every beginning of the winter season. You know why? Because, of course, the nature of the virus changes with every year. And every subunit that comes in, if you look at the vaccine for normal flu, for this year, it's labeled, 2021, based on the research done last year into this year to say this is the likelihood of how it's going to structure itself. And this is the vaccine that you're going to produce in helping fighting off, the bug. So this is how, vaccines basically by nature are designed and how they work.
So just to add on what Dr. Makemba is saying, is that in actual fact, this is why these engagements are necessary. Because even for COVID-19, we've seen that the different waves that are coming on. Now, these different waves are attributed to a number of things. Amongst those things is actually the fact that winter season also came into play. Because we must remember that coronavirus is a flu family of viruses. Therefore, just like Dr. Makemba is saying, maybe the consideration in future would be that before every flu season, corona will now be added to other flu vaccines. Now, that is what boosting and mutations and alpha and beta and delta and all these words are all about. Let's not think about these things as completely, yes, it's novel coronavirus, but the concepts of boosting, the concept of giving vaccine, the concept of giving immunity every year, it's all already been there. So that is why we sort of are giving a second booster depending on how the vaccine was made.
Designed.
Remember, this are different companies, and each company has a different research that they did based on how much of the vaccine they put in, and then they looked at the behavior. So they said, if we give this one in 28 days again, it's going to be enough. If we give another one, compared to the example you are giving, where someone had the disease on its own. Now, if you're having the disease on its own, fair and well, you survived. First of all, this disease is not just for yourself. Yeah. So you build up your own immunity. But remember, we are looking at the immunity of the entire herd, of everyone. So what vaccination is also about is that first you're protecting yourself from getting sick to death, but you're also protecting me from giving me that disease, because you don't know what disease am I sitting with. So if you're looking at the population, you've got two types of people. You've got those that are very susceptible and those that are not at risk factor, they don't have high risk. What we are trying to do with vaccines is that we are trying to protect both groups. If you say no, let's give this vaccine just for high risk, what about the carriers that you are creating in the low risk population? This is why additionally, so as I talk, I'm just adding concepts. This is why additionally, we said that those that are 18 and above, those are the risk populations for this group. They should get the vaccination first. It might be in future that next year sometime we'll decide, okay, now we know enough about coronaviruses, we should give the vaccine to those that are less than 18 years old as well. So all these concepts are actually moving in sync.
Thank you very much. So, Comrade Julius, as a nation, our patience is really running thin with the wearing of masks. And I heard you talking about national. So how do we ensure that and convince the public out there that national immunity is the way out of this? How do we achieve this? With the mutation of the virus taking place every time you're hearing there's this new variant, there's the alpha variant, there's the omega variant. How do we ensure this national immunity?
Comrade moderator, we should just stand together. We should unite, unity, strength during these trying times, and convince one another as much as we can. As I've said before in the introduction, the line ministry, which is the Ministry of Health and Social Services, has asked stakeholders and partners also to play their part, as we are doing as SWAPO Party Youth League this evening. So we should continue. We should also make sure that all the information pertaining to COVID-19 is translated into the local vernaculars. Church leaders, NGOs, everyone should be on board. And we should mobilize one another to get vaccinated so that we can achieve that specific percentage that the government has planned. So we should work together and we should share this message of vaccination. That's the way forward. That's what most of the other countries, especially Asian states and European states and the US have achieved, and Australia.
Yes.
Thank you very much, Comrade Julius. Dr. Over to you.
Yes, I just also wanted to allude to our viewers tonight that, you see, the regulations that are put in place. I don't want people to see it as being imprisoned, being restricted in their freedom of doing whatever they want to do. And I'm saying this particularly because in clinical practice now, what we are seeing is classical presentation. A patient would walk in. I traveled to the north to bury my uncle that passed away because of COVID. We came together as a family. We're probably close to 150, especially in rural areas, villages and farms. Oftentimes, there's not always police services to ensure that the maximum gathering is 10. I know these are very difficult times. Sometimes we want to pay our last respect to our loved ones, but it's very difficult as it is. But I would want to urge our people to say, let's keep the maximum gathering to 10. I know it's very difficult. You could render support differently if, for instance, somebody in your family passed. Instead of all of you coming together, maybe 100, 200, 300 of you in a family. I could give you a classical example of a presentation where an individual got COVID in the family, quite elderly, over the age of 70. The family came together to bury this individual. And then in that gathering, 2 more brothers got it. And then just a week after they buried this one, another brother died. They gathered together again. They bury that brother. Another week passes, another brother dies again. You know, so is this small gathering becomes a platform for maximum spread. And of course, when it's mourning time, funerals, people hug, people are trying to give each other emotional support. And of course, particularly as African people, we are very good at carrying each other's burden. And I do understand, you know, we want to support each other, but the reality on the ground right now is such that we need to be very careful, you know. And if you look, you know, especially rural-based, you know, regions are now starting to show, you know, more deaths, you know, people in the farming sector. I had a client in my office this afternoon. He told me of a family in the north where a lady got COVID, she died. There were 2 elderly people in the house, 3, they died, and another child. So now it's 5 people in one household that died, you know, and there were other people coming in to support. And out of those people that came to support, probably had contact with the caregiver that was looking after the sick person, likely to pick up corona and then getting sick and then, you know, possibly losing their life. So the message you are trying to send out there as well is social distance, you know, like our comrade Julius was saying, physical distance. Of course, you know, try to render support remotely where you can. Of course, if you physically have to be there, it's understandable. Be cautious, social distance, wear your mask, you know, sanitize, wash your hands, but where you can render support remotely, you know, without having to physically gather as a huge group, as a family, it's probably, you know, the most advisable thing to do right now, given the state of what we are seeing.
So just to support what Dr. Makemba and Comrade Julius is saying, when we look at health, there is something called social determinants of health. What are social determinants of health? Our culture. You must remember that when these viruses are looking at host, they are looking in thriving in environments that would allow them to thrive. Our culture is unfortunately, in this instance, part of those things that is spreading the infection. So the whole thing of reducing the number down, it's difficult for Africans, we know, because of our extended families. However, it's time to identify, especially those in our families who have fully vaccinated, who are completely healthy, who are young, to carry out tasks for the family, to represent. These are practical things. That's narrowing down groups. Social distancing. I know it's difficult to talk to somebody 1.5 meter apart, but we need to start doing that. One of the things that will help us with social distancing is to reduce our alcohol intake, because we are socially entertaining each other. Let's just do it and support government for the next 2 weeks. Like Dr. Makemba has said, those of us that are in health, directly or indirectly, we are seeing the mortuary numbers. We are seeing what's happening because we can't access theater. So let's reduce alcohol. Washing hands, it's another very difficult one. But washing hands will help even for other diseases, not just for COVID-19. For the next 2 weeks, so that we can just help public health measures and help the government to reduce the disease. So let's look at our social, cultural issues that are contributing to this disease.
And really, if you look, just to wind up on this one, if you look at what is happening currently, our health institutions are under tremendous pressure. Certain services in hospitals have to be suspended simply because we cannot cope with the pandemic. You know, outpatient departments in some hospitals are closed. Like you have seen circulars probably going out. Like Dr. Kanyemba was saying, he's a surgeon by nature. Elective cases, meaning that individuals that were supposed to be operated, that is not necessarily an emergency that could wait, has to be suspended just to curb the spread of the infection. If in the medical fraternity, we are even taking these measures, as difficult as it is, you know, you can imagine it's probably the best thing to do now. And I also know that economically, the measures, you know, are actually devastating to our economy, to our, you know, source of income. And I'm also appealing to our, you know, young brothers and sisters, especially who are running pubs and bars in informal settlements. I know that there are stories of people, you find somebody has a little tiny bar, he locks 30 people inside the bar, they are there until midnight drinking and having fun. Of course, on the outside, it looks like the place is locked, but people are actually inside. The danger is that, you know, out of those 30 that are gathered drinking the whole night through to midnight, when you now dismiss the crowd, you're likely going to infect each other. And tomorrow you will wake up and you hear that your next door neighbor that was in your pub until midnight is no more. And that next door neighbor might have been the breadwinner to that family. So what we are also appealing to the business community, especially in the informal sector, I know it's very painful right now. That also might be your only source of income, but do the responsible thing to do. If you're supposed to close at 1800 hours, please do that and make sure that you dismiss everybody so that we can curb the spread of the infection.
Time is jealous of us and unfortunately want to continue with our discussion. But to our viewers, definitely stay tuned for our next episode where we are going to discuss about the types of vaccines that are available and the vaccine efficacy in terms of their effectiveness for our next episode. And we really like to encourage the young people and the entire nation out there to say, the wise men once said, tough times don't last, but tough people do. And I believe we are not called land of the brave for nothing. So if we are to stand together during this moment of difficulty, eventually there will be a light at the end of the tunnel. So unfortunately, we have reached the end of today's discussion. Please stay tuned for more episodes to come from us here from the Soto Party headquarters. We would like to wish you a good evening. Please stay safe.